What do med spas have to do with gut health? Well, walk into almost any aesthetic clinic today or wellness clinic, and you'll see gut health programs everywhere. IV drips, peptide protocols, probiotic supplements, all promising to fix your digestion and boost your immunity. But here's my question. Who's actually qualified to tell you what's wrong with your gut? And is it really backed by science? I'm Dr. Kate D, and this is Med Spa Confidential. So before we dive in, let me tell you why I wanted to have this conversation. I've been seeing gut health absolutely explode in the wellness world. I'm talking about full gut healing programs, supplement protocols that could cost over $300 a month, peptide injections for inflammation, IV vitamin cocktails that claim to repair your microbiome, many places offering stool testing and elimination diet consultations. And look, I get why you're interested, and gut health is real. The microbiome really matters. But here's what concerns me. I've seen programs being offered by providers who don't have any specialized training in gastroenterology or gut health. I've read about patients being diagnosed based on symptom questionnaires alone without no actual testing. Med spas and wellness centers pushing proprietary probiotic blends that aren't FDA regulated, of course, and have no published studies behind them. And patients are spending thousands of dollars on protocols that might be useless at best or harmful at worst. So I wanted to bring in someone who actually treats gut conditions for a living. Dr. Tina Storage is a board-certified gastroenterologist. She sees patients with real digestive disorders every single day, and she knows the difference between evidence-based treatment and wellness marketing. And she's going to break down exactly what works for gut health, what the science really says, and what you need to know before you spend your money on any gut protocol anywhere. Because if a med spa or wellness center is selling you a gut health program, you need to know what questions to ask. You need to know what red flags to watch for, and you need to understand what legitimate gut care actually looks like so you can tell the difference. So at the end, I'll give you the 4 most important questions you need to ask at a med spa or wellness clinic before you start a gut health program. All right, let's get into it. So Tina, thanks so much for being here today.
Thank you for having me. I'm so honored to be on this podcast with you.
So what is the big thing that everybody's missing about gut health these days?
I think number 1, your diet really matters. Specifically, fiber is so overlooked and so key to our gut health. And we can dive into that, but I'll just say number 2 here as a plug, that the gut and the brain are intimately connected. So you can't achieve true gut health unless you've also really worked on stress levels and your brain health and your mental health.
Or what kind of fiber do we need, and how does that affect your gut health and your brain?
In the United States, I would say less than 20% of people, the data is around 20 to 30% of people get enough fiber in their diet. And that's because our diet is filled and inundated with processed foods. So there's sparse amount of fiber in there. And our microbiome, which are the trillions of not just bacteria, but fungi, viruses, other organisms, archaea, they live in this ecosystem, and they're well balanced when they get the foods that they like and they need. And the good bacteria thrive on fiber. That's how you increase the number of the good bacteria. And so what we've been seeing in GI is a real big shift toward dysbiosis, which is when that ecosystem we were just talking about is imbalanced. So there's more bad than good bacteria. And with dysbiosis, I mean, we're seeing more than ever bloating, constipation, loose stools, diarrhea, urgency, incontinence, brain fog, also SIBO, the rise of SIBO, which we can talk about, which is small intestinal bacterial overgrowth. We're seeing all of these sort of conditions because of that imbalance. And a lot of the key to reversing that imbalance is fiber. And, women need 25 to 35 grams a day. Men need 35 to 45 grams a day. Obviously, higher is better.
So what do the good bacteria do for you that's good? And what do the bad bacteria do that's bad?
So you've probably heard of probiotics. Probiotics are the bacteria. So they're the good bacteria you're trying to inoculate in your microbiome. So there's something also called biotics. And the reason I'm answering your question this way is that those postbiotics are what your good bacteria make. So when you have beneficial bacteria in your microbiome, they're going to make substances, most commonly known as SCFAs or short chain fatty acids, that are highly anti-inflammatory, not just for your gut microbiome. They strengthen the gut barrier. They prevent leaky gut and leakage into your bloodstream. But also, they decrease inflammation in the whole body. They also send signals to your brain. So we found that patients who produce more short-chain fatty acids actually have better brain health. So that's the importance of the beneficial bacteria. As far as the bad bacteria, they when they proliferate, they cause leaky gut. And, they're not producing those beneficial postbiotics. And what's interesting is that we tend to see when we do microbiome analyses, we tend to see that those bad bacteria, when they're proliferating, are not only reflective of chronic GI issues, but also even autoimmune disease.
Can you explain for our listeners why leaky gut is bad? Because I think that's really important. And I think that's a really big topic just in and of itself. So if you've been listening to the show, you know I've got stories for days about what goes on in med spas. I finally put them all in a book. It's called Med Spa Mayhem. I wrote it because I got tired of hearing about people getting hurt by providers who have no business holding a syringe. You'll read about real patients, real nightmares, but more importantly, you'll know exactly what to look for when you walk into any med spa and what questions to ask. It's part expose, part survival guide, and it might just save your life. Med Spa Mayhem will leave you informed, entertained, and a little shocked at what's really going on behind the business of the aesthetics industry. The link is in the episode description. Read it before you book your next appointment, because beauty should never come at the cost of your safety.
Absolutely. So yes, leaky gut is this umbrella term. And what it is your colon is one epithelial layer thick, just like one cell layer thick. If you think about that, your skin is, I don't know, so many cell layers, but your colon is one. And so the lining of it, don't worry, it's more durable than paper.
Right. The retina is like 8 layers. Okay.
Right. Or your colon is one cell layer thick, the lining of it. And so between those cells, you have something called tight junctions. And tight junctions basically are adhesive glue to that epithelial layer.
Right.
When you have leaky gut, those tight junctions start to open up. And when that happens, the food you're ingesting, and anything you're ingesting through your gut, there's no longer a barrier to keep it out, because food is really the most foreign thing we can introduce in our bodies. Yeah. And so there's that leakiness, and then bad bacteria, what we call LPS forming bacteria, release cytotoxins that basically can go through these pores and go into your bloodstream when they weren't really supposed to. They were supposed to be blocked out. And that can cause an immune reaction and inflammation that we think is the first step in a whole host of inflammatory diseases.
Right. So just like the skin, I think recently we talked about how the job of the skin is to keep the outside world out. Okay. Right. And when your skin breaks down, the outside world can get into your skin and you can get infections and inflammation and all that. Inside your guts is a similar kind of concept, right? You're putting food through you. So that's the outside world going in you. Okay. Mm-hmm. And ideally, we're not having random bits of that are not good for us get into our systems. And so what leaky gut is when there's a breakdown in that barrier inside your gut, right? And so that can make you sick. Just the same way if your skin is leaky, that can also make you sick. But this is kind of a big deal because you can take in a lot of not very good for you molecules that way, right?
Absolutely.
And people think, this is hearkening back to a very, very long time ago immunology class, but a lot of the allergens that we develop issues with, whether it's a food allergy or even just other kinds of allergies or even just autoimmune diseases of various kinds, get into your system and your system gets exposed to those allergens through your gut. And so it's very possible that you could develop an autoimmune disease because of chronic leaky gut.
Absolutely. Your immune system is seeing these foreign invaders and it's remembering that, oh, this is not my body. I need to attack. And so the more we can keep things that aren't supposed to get in our bloodstream out, whether it's if you have eczema, you need to moisturize to really improve that skin barrier, or leaky gut, the better.
Right. And so the bad bacteria are really bad because you're getting leaky gut. It could lead to a lot of different kinds of illnesses, a lot of problems. And that's why it's also confusing, I think, for people, because it's not one disease or one issue that we're talking about. It's like literally the health of your whole body could be jeopardized if these bad bacteria go gangbusters, right?
Absolutely.
So what you're saying is you need fiber to feed the good bacteria. So what kind of fiber do you need, and why are people not getting enough of that, and what can we do about it?
The reason they're not getting enough is because there's such an overemphasis on fast food and, our standard culture. And, in these processed foods, it's empty nutrition. There isn't a lot of fiber that you're getting, and a lot of good fiber and nutrition that you're getting to feed your gut microbiome. The types of fiber, so it's interesting that you brought that up. There are two main types of fiber, and I don't think it's important to differentiate in terms of microbiome health, but I think it's important to differentiate to see where do I start depending on what bowel habits I have. So there is insoluble fiber and soluble fiber.
Okay.
Soluble fiber is really good when you have like diarrhea, loose stools, because what it does is it solubilizes. So it's able to draw in a little bit of water and try to bring together, kind of form the stool more. And so we do use that oftentimes. We really focus on soluble fibers in people who have diarrhea, loose stools. So if you do have those symptoms, it's probably a good place to start. And then there's insoluble fiber. This is really good for our constipated patients. Insoluble fiber draws even more water in and helps the bowel movements move through. So if you want to know where to start, it just depends on where you are. If you have normal bowel habits, good for you. Start slow anywhere.
You probably don't see very many people who have normal bowel habits, I'm guessing.
Doesn't seem like it these days. But the main point is start somewhere and start slow, because you will not be happy if you just fiber max.
Too much in the wrong direction. So if you do have just sort of average normal bowel habits, then do you need a mix of both of those things? And where do you get?
That's ideal. The for the microbiome, if you're like, I just want a healthier microbiome, I'm in the middle. Where do I start? Variety is key for the microbiome. Variety. So don't just say, okay, I'm hitting my, let's say, 25 grams, 30 grams a day, and I'm eating both soluble and insoluble fiber, but it's the same fiber every day. That is, obviously that's going to help someone. It's going to grow certain beneficial bacterial species, but you want to grow all of the variety and make that garden flourish. So what I do when I go to the grocery store with my kids is I pick certain fruits and vegetables, and then it's a game with them. I tell them, okay, do you guys remember what we got and ate last week? I want you can't pick the same thing. So then they pick different things.
Can you just tell everybody, so what kinds of foods have fiber in them, and what ones have more than others, so that people get an idea of what they should put on their grocery list?
Lots of fruits and vegetables. I can tell you what's on my grocery list. So the berries are great. They have a good sort. Raspberries actually are a tremendous source of fiber. Berries in general, because they're a lower sugar fruit as well. So you want to kind of focus on that. So berries are blackberries, blueberries, raspberries. The best fiber, if you want for constipation, are yellow kiwis. In fact, there was a study.
Kiwis. Okay.
Yes. So yellow kiwis
are those the less fuzzy kind? I feel like they're not, right? So
they're not. They're the smooth skin kind.
Yeah. I was on vacation with a friend recently, and she just bit right into one of those, peel and all. And I was like,
great microbiome.
It's a little sour, the peel, but it's better than the green fuzzy ones. Okay. Yellow kiwis. That's going. Okay.
So what I tell my patients actually who are constipated is get 2 yellow kiwis, wash it well, and then cut it in thin slices with the skin on. So when you cut it in thin slices, you don't get that really sour bitter taste. And if you want, sprinkle that on some oatmeal, which is a great fiber source as well, and walnuts, right? Nuts are a great fiber source. So there you got the fruit, and the peel actually has a lot of antioxidants and polyphenols. You got the walnuts in there, good for your brain health as well. You have your oatmeal, which is a wonderful source of soluble fiber. And then sprinkle in some chia seeds. I love chia seeds, especially if you can sprout them. So that means just put them in water. You can see already that they're forming a gelatinous layer. And that's a wonderful source of fiber. So right there, you have an oatmeal ready to go packed with fiber. Lots of fruits and vegetables. I mean, vegetables, kale, any sort of lettuce variety, chard is really great. Artichoke, it's a wonderful prebiotic. We talked about probiotics and postbiotics.
Even if you're only eating the mushy part, still good.
Yeah. Okay. Yeah, definitely. Still good. Okay. And it's a wonderful. So yeah, happy shopping.
So what about fiber added to your diet? So are any of those recommended, or is it just, too much of one thing that's too much, or what would you recommend there?
A fiber supplement is what you're asking?
Yeah.
I think in today's society, we're all really busy. And I'll be honest, I even struggle to get, even though I know the data, I struggle to get in close to 35 grams a day with just, work and kids and school and everything. And so if you're someone that consistently has a really busy day and you're not going to really hit that mark, then adding in a good fiber supplement is not wrong. Actually, I recommend it in a lot of my patients who are constipated or have loose stools. Again, some fibers are good for diarrhea versus constipation. Some are good for both. And it's a nice way to just ensure you're hitting that number every day.
Is there anything else about nutrition that really affects gut health besides fiber intake?
Limiting certain foods. I don't like to restrict any sort of good food for you. Go for it. I'm not so much someone who believes in okay, it has to be a paleo diet or a keto diet or, a carnivore diet. But what I would say is we have a lot of added sugar intake. So really eliminating the refined sugars. That's really inflammatory for the gut. Processed foods. If it has more than, I'm going to say lucky 4 ingredients in that bar or in that package, I would toss it. So sugar, processed foods. Number 3, seed oils. I think that's coming to light more and more, eating things. Previously, we used to cook with canola oil, sunflower oil, safflower oil, and it's in the restaurants that we eat at. Soybean oil, they're cheaper oils. I'd really focus on olive oil, avocado oil, and unrefined coconut oil, ghee, if you can tolerate some dairy. So that would be number 3. And then, and that's as far as I would say to start with what to eliminate.
And is that because of just basically inflammation? I mean, all those things are things that are in an inflammatory diet. I've been on an anti-inflammatory diet for many, many years now. So is that the main reason why?
Yeah, we found it in some, they're not going to be great studies, especially like seed oils, but the thought is that it does induce leaky gut and it does feed the wrong bacteria. So yes, over time, if you have, one meal every couple of weeks at a restaurant and they put some soybean oil in there, it's not going to probably do too much unless you have a sensitivity to it. But if you're doing this, you're eating out and you're doing this every other day, daily, every 3 days, it adds up.
I had studied this many years ago when I started on this journey myself. And the seed oils have a very low burn point. And so once they reach that and you're cooking with it, then there are a lot of sort of toxic byproducts that get created during the cooking process. So they might not be as harmful without using them for cooking. Whereas avocado oil has a higher burn point. So there's way fewer of those when you cook with avocado oil. That's my kind of understanding of it.
Right. And avocado oil you could use with higher heat levels. Exactly. Yeah. That's what I actually use when I'm going to put something in the oven, as opposed to I'll use the olive oil, if I'm going to fry some eggs or something.
What about physical activity? How does that affect your gut health?
Oh, in so many ways. So, number 1, I think just going back to the gut brain, physical activity releases endorphins. And we know that it the brain releases certain chemicals that make the gut more calm and more fortified. Less of the anxiety, feeling the nervous stomach if someone's exercising regularly. Number 2, it helps gut motility. I mean, there are clear studies that if you exercise on a daily basis, your gut motility improves. So if you're struggling with bloating and constipation, that's a great way to start. There is a great study that shows that if you walk after 5 to 15 minutes after eating, we call it the fart walk, then
How old are your kids again?
4 and 7.
There you go.
I love it. I tell them it's time to go on our fart walk. It's great for gut motility. It's actually around the time when things are moving into your small intestine. So it's great for bloating. It's great for blood sugar regulation. So if you're someone that struggles with that, it's great. Then the magic window is really that 5 to 15. When it gets to like 30 to 60, you're probably not getting as much of a benefit, but still a benefit on your motility.
Meaning 5 to 15 minutes after you finish eating?
Yes.
Okay.
That's the sweet spot. That's the
Okay.
sweet spot.
Good to
But
know.
just because it's been 20, don't not go for the walk. You should still get steps. It'll still help with motility and moving things along. But I always tell my patients, if you want your gut to move, you have to move. So it's great for that aspect. And definitely I see a difference between the gut-brain connection. One other thing that I just thought of that's been greatly beneficial for your gut health is eating fermented foods before I forget. And again, these fermented foods have the probiotics in them. If you have at least a tablespoon of fermented foods per day, we find that those people have much healthier microbiomes. So, I just go to the refrigerated section and get fermented cabbage, there's fermented carrots, there's pickles, there's fermented green beans, kimchi. So you can just go to that refrigerated section at Whole Foods or Trader Joe's or wherever and get that. And if it's just in salt and water, even better than if it's in vinegar. Theoretically, the vinegar kills the bacteria. Theoretically, I don't have great evidence on that because there are societies, that have always put their fermented products in vinegar are doing great. But yes, a tablespoon a day, that would really, really, really help the gut microbiome.
And are there drinkable fermented things? Like, isn't kombucha and stuff like that popular for that reason?
Yeah, kefir, kombucha. The only thing I'd say is obviously if you have a dairy sensitivity, kefir is going to be a little bit tough. You could get some fermentation through certain yogurts. If you do have a dairy sensitivity, sometimes it might just be cow's dairy. Sheep and goat are a little bit less inflammatory and a little easier to digest. So reach for that sheep's yogurt or the sheep's feta or the pecorino instead of the Parmesan. And then as far as kombucha, it's theoretically great for you. Just be careful of all the added sugar that's in kind of more of the commercial processes.
Oh, yeah.
I would try to opt for ones that don't have a ton of added sugar. There will be some sugar in the natural fermentation process, and that's fine, but not the ones that have, let's make it really taste good and put all these sugars in your body now.
For that yogurt, it's interesting you mentioned that. I think it's much easier to find goat yogurt now than sheep yogurt, although I really like sheep yogurt. But Trader Joe's for sure has it.
And a lot of goat.
Yeah. And I like that too because there's not extra sugar in it either.
Absolutely.
Yeah.
We have my kids call it special yogurt. And if you like your yogurt a little sweet, and what you could do is just take a very ripe banana, mash it. You'll get the sugars from the banana and then mix the yogurt in, add a scoop of nut butter, great fiber, put some blueberries on top, great polyphenols, sprinkle some chia seeds and there you go.
That sounds awesome. Let's go back to stress since we're both doctors. We know how stress works. I remember one of my classmates in medical school used to, like right before all exams, he would literally have diarrhea. He literally would miss class because he was so stressed out. He would have diarrhea. So how does that work? And what can people do to change their brain gut interaction?
I will tell you that I think almost 50% of my practice are gut brain disorders these days. Mm-hmm. So that class 8 having that reaction, the nervous stomach, that is very, very common. So if you're listening to this and you feel like you're alone or embarrassed or going to be stigmatized or not, it's a very normal occurrence. And it just means that your gut-brain axis got a little dysregulated, and it can be re-regulated. It's not all in your head. It's not normal, and forget about it. It's something that if it affects your quality of life, you should seek some help. So what happens, the gut and the brain are connected via the vagus nerve. A lot of times, I think in our society, we're very sympathetically activated. What that means is it's the fight or flight response. So we have constant stress coming in, whether it's through school or work or media. And we're constantly in this hypervigilant state, which has traditionally been very protective for us. But it just leaves you right? Like you're just constantly waiting for the next thing to be sprung upon you, and
Right.
you want to be ready for it. Unfortunately, although it can be protective in many things, if your friend probably studied a little bit more because he was so anxious, maybe, so it does benefit us in some way. Too much of it really does wreck our gut. And
I think he was busy doing a MDJD too, so that might have been extra stressful.
Wow, that is very stressful. Yes, I remember I had a couple of those in my class too. So what happens when the nervous system is very sympathetically activated is that you develop something called visceral hypersensitivity. What that means is things that are normal, for example, the gut motility increasing a little bit when in times of stress, or your food moving from your stomach into your small intestine, which these are just normal parts of digestion, right? Some of your gut bacteria making some hydrogen or methane gas. It's interpreted as pain or urgency or a need to go to the bathroom. The brain interprets it as danger. So it fires when it's not supposed to fire. And so you get this hypersensitive response to normal digestive processes. And once the brain has recognized that as danger, the circuit continues. And then this person is like, okay, anytime I go out or get in a car or go out with friends, I'm going to have diarrhea, because it's just that circuit has been strengthened over time. And so what needs to happen is we need to break that circuit. And that's what we do a lot of times in the clinic, in the GI clinic, is, we obviously rule out other pathology, but once we've ruled everything else out, we realize this is more of a gut-brain connection, and we need to kind of calm those nerves down and teach them you can fire when you need to fire, because obviously that's protective, right? If you're having something serious going on like appendicitis, but don't fire when everything is normal. And that's what we're reteaching those nerves.
How do you do that?
Few ways. The first step is obviously awareness. And I think in and of itself, that's very validating and freeing, because these patients have gone to multiple physicians and have been dismissed and have been told nothing's wrong with you. And, just your endoscopy, your colonoscopy were normal. Your CAT scan was normal. Just live with it. And they go home feeling hopeless. Right. So I think just validating first that concern, and that, no, this is not normal. We can't measure the gut-brain disorders, right? There's no test. You could be like, yes, you have this. It's a really clinical diagnosis. And so validation is the first step. The second step, we go one of three ways, but the mainstays are gut hypnotherapy now. I don't know how many, we have GI psychologists now. So
that's so interesting.
Psychologists trained in GI, gastrointestinal diseases. And I think there's only 100 of them in the country. So obviously not everywhere is going to have that resource, but if there is a GI psychologist, we refer to them for gut hypnotherapy, and there's GI cognitive behavioral therapy.
Okay.
If that's not available to them, there are a couple apps, one mainly that I use, that will deliver the gut hypnotherapy through the app. Patients do it 5 out of 7 days of the week for 6 weeks. There's about usually a 30 to 40% response at the end of 6 weeks. And if they maintain to 6 months, we can see upwards of a 90% response where a patient really has their life back.
Wow, that's interesting. I mean, is this more than just diarrhea? I mean, is it just stomach pain?
Abdominal pain, constipation, any sort of symptom that can't be explained through, endoscopy, colonoscopy, imaging studies, blood tests. That is very much associated through patient history with certain stressful responses.
Right.
right? Every time I go out with friends, or every time I get in the car and I'm sitting in traffic, or before I have a big test.
Right.
And so gut hypnotherapy is one way, which is really great. And I really do advocate, but we have really good data on it, good data. The other thing we use in GI clinic now is we actually use antidepressants, but not for depression. We do not use them at the same doses as a psychiatrist would. We use tricyclic antidepressants. Psychiatrists used to use them, I think, at doses of 150.
We've been out for a long time now, ever since Prozac hit the market, but
no
they
one
work
uses
well
them.
for gut issues. That's interesting.
Incredibly well. We use doses. We start at doses of 10 milligrams. I think psychiatrists use 150 to 300 milligrams. So tiny doses to really help cut that circuit. We just need to cut it. And sometimes patients need both. Or, usually if you do both, it's like almost, it's synergistic, you tend to do better. But I usually have patients on it for about 6 to 12 months. And hopefully with the gut hypnotherapy to have something that can maintain them once we come off. And just breaking that connection, that circuitry helps them get back into rhythm. So it's fascinating. I've seen countless people who I had a follow-up the other day on Thursday, and it was a 60, 70-year-old female who stopped going out with friends. Like she just stayed at home because she was having so much incontinence and diarrhea when she'd go out. And we put her on both, and I see her all the time, every 4 months now, and she's like, I'm going on this. She's going to Vancouver. She's going out to dinner every other night. So it's fascinating how well it works.
That's so interesting. I mean, so it is, though, it's important though, right? To have a workup and make sure you don't have anything wrong. So you really do need the test first to make sure that there's nothing else going on, right?
100%. Yes.
You really need to see a specialist first to make sure that you're not just blowing off something that's really medical. And
absolutely. I mean, at the minimum, blood test, and we have a stool test now called a calprotectin, which is a great measure of inflammation in the colon. We, at the minimum, doing some blood and stool testing, and even some imaging and an endoscopy, colonoscopy if your symptoms warrant. Because at the same time as we're seeing an uptick in dysbiosis, gut-brain disorders, we're also seeing an uptick in colon cancer in younger and younger patients, which, I've personally witnessed and have diagnosed. So yes, do not, go see a doctor if you're having any new symptoms or concerning symptoms.
So shifting gears for just a second, can you tell me a little bit about your new gut health brand and what you're working on there? Because I think that's really interesting.
Yeah. So we've talked about kind of a lot of things that are detrimental to your microbiome. Whether that's processed food, added sugar, seed oils. One thing that has raised awareness most recently is microplastics. So microplastics are these plastics that you're not really seeing, but this is my glass water bottle, by the way, but in a lot of
I've got my glass of water.
Oh, cheers. So in the standard water bottle that you may drink on a hot day, it's the plastic, water bottle. And there are microplastics leaching into the water, and you're ingesting that. And again, it's going into your gut, right? And your gut, especially if there's a little bit of leakiness, which in a lot of guts there is, those microplastics can get absorbed into the bloodstream. And we've actually seen it in studies now, mouse studies. We have seen microplastics now deposited in the brain, the liver. And most recently, we've found microplastics in cancer tumor cells that we've taken out, like tumor masses.
Does it matter what kind of plastic, or do they all each the same?
All plastics, just because they're foreign particles that really provide no nutrition and positive, support to our gut. It's really all of them, but there are specific ones that are harder to break down and have more of a little bit of a detrimental effect. So what they've done in the lab is that they've taken these probiotics, like lactobacillus is one of them, bifidobacterium is another, that create this biofilm. So we were talking about what do these good bacteria create? They do create a biofilm, and that's actually really important for leaky gut as well. And that biofilm tends to absorb plastic so that less of it is getting absorbed into your system. So we thought this was fascinating because people need more probiotics and beneficial bacteria in their gut microbiome. We've been seeing a dropout of a lot of beneficial bacteria in the modern day microbiome compared to, 100, 200 years ago. And probiotics have such little detrimental effect if you take them. So why not take something that's beneficial with such little downside and see if it can work against this issue? Because we have also clear data that microplastics cause leaky gut, inflammation, and dysbiosis, and get deposited in many organs and lead to an immune response and even cancer.
Aren't they building up in the oceans too? Like, aren't the fish getting, especially the big fish that eat all the other fish, don't they concentrate? Kind of like mercury?
Yeah, exactly.
Yeah.
Absolutely. And so we thought that this would be great. We did a lot of research on this and thought that there is no supplement that one can take on a daily basis for microplastic clearance. And here's one that has no detrimental effect and a lot of possible benefit. Why don't we create this for overall gut health and microplastic absorption? So we're working on that now. We're using the strains that have been used in studies. We're adding in a prebiotic there, so it can, those probiotics can prebiotics. I didn't mention this, but they're foods that good bacterial strains probiotics take in so that they can flourish even more. So your fiber is a prebiotic,
Right.
kiwis is a prebiotic, artichoke, asparagus. So we're combining those strains with a prebiotic, and hopefully that's something that people in the meantime can take every day to decrease their microplastic burden.
That sounds great. Is that on the market yet, or are you still just researching it?
Not yet. No, we're actually formulating it as we speak, and we're hoping for it to be on the market in March or April of 2026.
Oh, amazing. And what's that? What's your company called?
So the brand will be called Two Doctors. Myself and one of my colleagues, Dr. James Tabibian, who's an MD PhD, are formulating it ourselves with the help of a pharmacist. So it's completely physician formulated and studied. And so we're working out the details because, we can talk about supplements now too, but my gripe with supplements is that there are so many additives and preservatives that I don't want in my body, even though there's some benefit to the supplement. I mean, these supplements have added sugars and natural flavors and citric acid and, so many things I can't pronounce. So the hard part has been coming up with this wonderful supplement without any of those additives. Just a clean, something where if you take it every day, there's nothing in it but what you really need. So that's why it's taken a little bit more time, but hopefully March and April. And in the meantime, my colleague and I, Dr. James Tabibian, have created a newsletter because they're a free newsletter that we send out weekly because there are so many gut health myths. And I think it's not talked about enough. So we pick a topic weekly and send that out to people's email just if they want to learn about anything gut health.
Okay, well, so can you tell our audience how to reach you? And we'll obviously have links to everything in the show notes, including the newsletter, how to sign up. But how can people reach you?
So you can reach me on my Instagram at Dr. Dr. So not doctor, don't spell out doctor, but at Dr. Tina, Tina, storage, like a storage company, at Dr. Tina Storage. And then for our newsletter, if you want to sign up and just get gut health topics emailed to you weekly, you can go to Dr. Versus, DoctorVersus.com. And each topic we talk about some, it's versus because it's doctor versus colon cancer. And we talk about colon cancer, or doctor versus microplastics. And we take on a topic and we're more than willing, if people had feedback or topics they want to hear about, we'll go ahead and write on that.
Oh, that's so cool. Yeah. I mean, I think that I had a friend who asked me, like, well, how does gut health relate to the med spa aesthetics industry? And it totally does. There are so many clinics offering this kind of thing, and it's so varied of whether they make any sense or not. And some of them do. And then a lot of them are just selling a lot of supplements because that's how they make money.
Yes.
So I just feel like understanding this stuff is so helpful so that you can know what to do for your own body. And then when you really do need a specialist like someone like you, then we know where to turn. We don't just go to the, rando down the street. So that's why I really like to talk to people like you.
Thank you. I know it's really overwhelming, I think, in the current day and age with all these supplements now coming out, and you're like, what do I take? Like what for my gut, what do I do? And so I think what's nice is that if you see someone well-versed in that, or someone hopefully you trust, is that they can really pare that down for you. And gut healing and has become a lot more individualized than it used to be. We used to just give the same regimen to every single person. Now that we're able to really do stool testing to look at someone's microbiome, we're able to see, okay, there's an imbalance here. They have too many of this bad bacteria, too little of this good bacteria. And we're able to target it in a more individualized fashion so that, people aren't just buying supplements blindly.
And I know I had run, so, your pre and probiotic combo is not out yet. And I have been taking a prebiotic now for like a good year, at least probably a couple years now. It's called Just Better. I'm just going to plug it because I like it. And it is, and you taught me this. So it's pure. There's no additives in it. It's just, what did I say? Corn fiber, whatever. I don't know why, but I just feel like it makes everything sort of regular all the time. It's that like, I don't know. So hopefully it's feeding all the good bacteria in there, and I'm not cool. I especially think it's important when I travel. I don't know why, but in my brain, it's like I have to bring it when I travel. So, because, your diet gets really messed up when you travel.
Oh, yes. So I always say what's funny is that my constipated people always do worse when they travel. For some reason, with the brain gut and stress, a lot of times for people, the motility slows down. For some people, it can speed up.
Well, airplanes, not good for that.
Yeah, right. Exactly. But I always say, yes, take it. Your gut habits will change when you travel completely. Yeah. So you're doing the right thing. Your hunch is correct.
Right. Well, I will look for your stuff when it comes out, or maybe we'll have you back on when you're ready to launch.
I'd love to come back. Yeah. This was so much fun. Thank you so much for your time. And, it was wonderful having a conversation with you.
Yeah. I just so appreciate your being willing to come on the podcast and talk about this stuff. So yeah, let's put something on the books for early next year. And thank you so much for taking a time on a Saturday for this.
Absolutely. It was my pleasure. Thank you.
So that was Dr. Tina Storage breaking down the real science of gut health. Now, here's what I want you to take away from this. Everything Dr. Storage just explained, that's what evidence-based gut health looks like. It's not expensive. It's not complicated. And most of it doesn't require any supplements at all. But if you walk into a med spa or wellness space offering gut health programs, ask these questions. Who's diagnosing you? Is it someone with actual GI training or someone who took a weekend certification course? What testing are they doing? Real gut issues require a real workup. Blood tests, stool tests, sometimes imaging or scopes. A symptom questionnaire is not a diagnosis. And what is the evidence behind their protocol? If they can't show you published research, if they're selling proprietary blends, if they promise results in 30 days, be skeptical. And finally, are they making money off supplements they're selling you? Because that's a conflict of interest. If that's their end game, they're just trying to get you to buy something you probably don't need. Links are in the show notes. And if you've had experience with these gut health programs, I want to hear about them. I'm Dr. Kate D. Thanks for listening. If you found this helpful, do me a favor and share it with a friend who's considering any aesthetic treatments. Subscribe so you don't miss the next one, and drop a comment telling me your biggest takeaway. I actually read them all. Let's keep each other safe and elevate the standards in the med spa industry.